Well, I first started training as a student radiographer in September 1978 over at the Luton and Dunstable Hospital. After I qualified in 1980, I went to work at Southampton General Hospital and I found an advert for the West Suffolk Hospital. They wanted to train a nuclear medicine radiographer, but also retain the skills in general radiography. So in January 1983, I first walked across the threshold of the West Suffolk Hospital to be a trainee nuclear medicine radiographer. In those days, we had 6 general X-ray rooms, the gamma camera, and we then had 3 or 4 ultrasound machines. We were already using ultrasound in antenatal screening and a little bit of it in general abdominal ultrasound, but we had absolutely no CT scanners, and I don't think we'd even heard of MRI scanners except very, very theoretical. The first impression that anybody would have of a radiology department in those days was the smell. We had these things called automatic processors, and they could process a film from taking it through to having a dry film in your hand, so they would develop, fix, wash and dry them in 90 seconds, which we thought in 1980 was absolutely fantastic after all the dipping of films in wet chemistry, which took forever. By the late 1980s, it was quite clear that we would need a CT scanner at the West Suffolk Hospital. So we did a lot of fundraising. We had to go out to the general public and say, pretty please help us to buy a scanner. And by 1990, we just had £750,000 needed to buy that first scanner. It was a massive change. We had an MRI scanner in the late 1990s, but it was limited to 400 patients a year, so there wasn't enough capacity. I took over as the imaging services manager in May 2000. By 2003, it was very, very clear that we needed an MRI scanner. We simply didn't have the capacity on the old one, so we put in a new MRI scanner in 2003, and it was opened by Terry Waite. So the only screening we had basically when I started was antenatal screening. So we would measure the size of babies, and that was basically it. These days we can ultrasound so much and do so much with ultrasound. But the thick end of 30 years now, we've been doing breast screening, and I mean picking up an awful lot of cancer that otherwise we would never have picked up. And clearly the CT scanners and the MR scanners are in use a lot for frontline diagnosis, but increasingly you're seeing them being used for screening. You're seeing CT scanners used for screening for lung cancer. MRI scanners used for screening for prostate cancer. So you're seeing these wonderful pieces of technology, and I would say they're wonderful because I'm a geek, being used to seriously improve patients' health and outcomes, and more for proactive management of health. When I started, radiography was very technical, but I think I learned very quickly that if you were going to get a good image of a patient, as much relied upon your ability to reassure that patient, to calm them, to help them through the process. Because, I mean, X-ray machines in 1978 looked scary too. CT scanners and MR scanners, yes, they are big, they make loud noises, they are frightening, and they are now much more computer controlled. But what no computer can do, and I think will ever be able to do, is reassure a patient. And I think the radiographer will always bring that human touch to an otherwise very, very technological and scientific branch of medicine.